So we are going to answer some common questions and answering some comments from some videos that we recently posted. So
Okay.
you're going to answer some questions, okay? Do you do veneers? And is this a good option for me?
Veneers. Yes, we do veneers. Veneers are definitely a great option for a lot of cases. Obviously, we will assess you to make sure you're a great candidate for veneers. One of the top reasons why veneers don't work for some patients and people have complaints out there about veneers is they were not a good candidate to begin with. And a lot of times the best work, when you best laid plans that are put into the wrong scenarios still results in a compromised treatment. And veneers, if you're a good candidate for it and it's done very well for you, will last a lifetime, just about. We just don't want to jump into veneers when you have much better treatment options that are available that'll be better for you.
What is the difference between all on 4, all on 5, all on X?
Okay.
It's very confusing.
Absolutely. So all on 4 in general, bit of a history lesson here. All on 4 in general was essentially propagated by one doctor out from, I believe, Spain, Malo. And the idea was that if you wore dentures for many, many years and the bone is shrunk down and the denture doesn't fit anymore, things are falling out, we can use the small amount of bone you have left to place 4 very, very long implants to hold that denture that has been converted to something that's fixed in your mouth so it doesn't have as much movement. That's how the all-on-4 in general was built or designed. You have very minimal bone. We try to place 4 implants, spread it out, put a full set of teeth in your mouth. With time, technology has allowed us to be able to take that concept and apply it to somebody who still has teeth, just not in great condition, without going through 20, 30 years of dentures first. That's where the all-on-4 comes in. As a result, we've also learned with time that having more than 4 implants do the work is better, especially when you get materials that last a lot longer, like porcelain materials. So you have 16 teeth normally per arch, meaning 16 on top, 16 at the bottom, counting your wisdom teeth. If we were to replace, say, 12 or 14 of those teeth, and we use 4 implants to do that, as you can imagine, 4 anchors for 12 or 14 teeth is not always the best decision. Hence the all on 5, all on 6, all on 7, all on 8. More anchors we have, the better your chances of a longer lasting prosthesis. That's generally the differences there. And here at Amazing Dental Solutions, we will assess you personally and try to figure out what's going to give you the length of time you require for your prosthesis and how many implants it will take to get you there.
Can this be done all in one day?
Yes, absolutely. This can be done in one day. We do let you heal. We will design the teeth. Basically, we will get you your final, usually the same day or the next day. However, what we try to do in an effort to make sure that this fits not just today, but tomorrow, next year, the year after, because your mouth changes. You're a living person. Your mouth will change. The prosthesis will not change. So we allow some time for things to heal, and we just sort of backfill that area that has changed so that the fit is exacting on the day of surgery and 6 months down the line. But we can get you the design exactly the way your final will be. We will just make it in a material that's quick enough to manufacture so you can put it on, you know what your final looks like, you know what your final feels like. And then we come back in and backfill it and change it to your final material when you're healed.
What is an implant?
A dental implant essentially is a replacement root of a tooth. I know there's a misconception that when you get an implant, you're getting a tooth. A dental implant wasn't designed to be a tooth. It's designed to replace the root of a tooth. So all our teeth have about 1/3 of the tooth in your mouth. That's what you see when you smile. It's just about 1/3 of the teeth. The other 2/3 are found inside the bone. That portion is what gives your tooth the stability. Without that, like when you have bone loss and you lose half the bone around there, the whole thing starts to move because you need about 2/3 of your tooth to be inside bone for it to be stable. Problem is when you have enough cavities and you destroy the tooth in your mouth, there isn't enough for us to build on top. And all the technology we have today allows us to bond a crown, a filling material onto a tooth. What a dental implant does is that it replaces that root. Now we have a way to screw a tooth into that implant, which is a lot more, essentially, it's a lot more stable and it lasts a lot longer than just bonding onto the root. So a dental implant replaces the root of a tooth and allows us to build something on top, whether it's a single tooth, a bridge, or a full mouth of implants of that root that's buried in the bone.
Is this going to hurt?
This is surgery, but the beauty of it is that with technology and advancements in science and all the things we've learned to manage pain, this isn't going to hurt nearly as much as you think it would. In fact, a lot of our patients that do our full mouth rehabilitation tend to take the medications maybe the day after, maybe 2 days after, but generally no more than 2 to 3 days. And by the second day, you're feeling pretty comfortable. A big majority of our patients have mentioned over and over again how little to no pain they felt after having a full mouth reconstruction done.
I don't have cash. What payment plan options do you offer?
So that is one of the big background work we've done here at Amazing Dental Solutions. We have worked with several different lenders and banks who use our history here at this office, plus the patient's credit, to offer several different terms and loans for our patients. This allows our patients to finance some of these procedures all the way up to 12 years. So if you're looking for a way to make this treatment affordable to you in a monthly payment that is more budget friendly, here at Amazing Dental Solutions, we have options for that. And the best part is we don't hit your credit unless you actually accept the loan, then it's reported. So this allows you to take a treatment and break it up into payments over the next up to a decade or 12 years, even if necessary. Continue to work with different banks, and we continue to assess different banks to see what we can do to offer our patients our best possible deals out there.
How do I prevent tooth decay and gum disease?
So prevention of tooth decay is very different protocol than prevention of gum disease. Those are two different things altogether.
Okay.
Prevention of tooth decay is the normal things about candy, sugars, carbohydrates. But the part, and I think everybody knows that, everybody understands that you don't eat a bunch of candy if you want to keep yourself from getting a cavity. What people don't realize is that even when you eat healthy foods, if you're consistently eating them, snacking, meaning every couple of hours or so you're eating something, even a small amount, you actually accelerate decay. And it's because your mouth doesn't have time to clean out the food that you just ate and bring the pH level up enough to where it's a little more neutral. You eat, the pH level drops, it becomes more acidic. So the longer your mouth stays in an acidic environment, the easier it is for the bacteria to break through your strong, tough enamel and create a cavity. So in addition to brushing properly, flossing, brushing twice a day, and not eating as many sweets and candies and gummies and things like that, it's also the frequency of eating and drinking. The more you do it, the easier it is for the bacteria to break through that enamel defense and get to the more nutritious part of the tooth and cause a cavity. Now for gum disease, it's a little different. Yes, brushing helps a lot. Flossing actually is a bigger factor with gum disease to be able to prevent it. Being able to remove things that are stuck onto your tooth under the gum line is the essence behind bone loss. It's really what stops you from having bone loss and progressing with bone loss. So cleanings, visiting your dentist often, those are all things that will prevent gum disease. So those two things are related, but they're not the same cause. Even the bacteria that causes gum disease is not the same as the bacteria that cause cavities in general.
Is my insurance going to cover this?
Dental insurance is still a bit in the stone ages compared to medical. It doesn't have as much coverage as a medical insurance. So with medical insurance, you typically have an out-of-pocket maximum, and after which most of your insurances will cover the rest. Dental insurance works exactly the opposite. You usually have a maximum for the insurance, and then you cover the rest. So will your dental insurance cover this? In most cases, yes, the answer is yes. But just as we said before, your insurance tends to max out and then you cover the rest, which is exactly the opposite of how medical insurance typically tends to work. So the short answer is yes. But how much of it do they cover is really the difference between plans.
That's all I have for today.
That's a good start. Yeah.